Hello and welcome to our presentation. My name is Michael Duane, and along with my course colleague Heather Cronin, we will be taking you through our research project. Remote patient monitoring beyond the COVID-19 pandemic, using the NASSS-CAT framework and an adapted version of the complexity assessment tool with a cystic fibrosis telehealth team, with consideration for how this approach can help inform how telehealth solutions are introduced, scaled up and sustained. As the title suggests, our project encompasses a number of areas, which we will take you through briefly. Remote patient monitoring has a key role to play in meeting the known demands on health service capacity associated with an ageing population and increased prevalence of multi-comorbidities. Aligned with the vision for Sláintecare, clear opportunities exist for remote patient monitoring telehealth implementations to deliver care closer to the patient's home. Health systems internationally have rapidly expanded the use of video consultations and remote patient monitoring solutions to cut down the risk of transmission of COVID-19, in many cases implementing at speed. We know from the research that telehealth innovations often fail to spread or be sustained in complex health and social care systems. While significant recent gains have been made in adoption opportunities, and challenges now remain in areas such as health technology assessment, data protection and security, and information and clinical governance. Our project worked primarily with the adult cystic fibrosis telehealth team at Galway University Hospital, and with additional input from key stakeholders involved in similar remote patient monitoring efforts in a Dublin-based acute hospital. The team in Galway had approval and a vendor in place to deliver remote patient monitoring prior to COVID-19. This process was then accelerated in response to COVID-19. Using their smartphone, a person with CF can connect to mobile medical technologies such as a handheld spirometer, pulse oximeter and scales provided by the CF project team. Benefits include better access, increased convenience, reduced travel times, cost savings, with clinicians access to data driving improved decision making, early intervention and patient safety. Building on research that shows that technology innovations in health and social care are a combination of implementation success and system success. Our project was interested in working with the team in Galway and additional key stakeholders from a separate organisation to surface and explain implementation complexities, influencing scale-up of their digital transformation. We use an analytic framework and set of tools developed by a team of researchers in 2020 and led by Greenhalgh called the Non-Adoption, Abandonment, Scale-up, Spread, Sustainability, Complexity Assessment Tools, NASSS-CAT. We were also interested in examining the potential value of using the NASSS-CAT tools as a way to help guide decision making about project readiness and in how solutions are introduced, scaled up and sustained. This illustrates the stages of a research process. The ideation and preparation phases helped inform the design of our adapted NASSS-CAT survey tool and in extending the research to include participants' feedback on the approach. There were a total of 50 participants involved in our project. Phase 1 of the process involved complexity mapping. Phase 2 focused on analysis of participants' views and experiences of the approach. A mixed method approach was taken and quantitative and qualitative data was analysed. Interview transcripts were analysed using a thematic analysis approach. A research report documenting the findings is available to all those who participated. In the first phase of our project, we adapted 2 of the NASS complexity tools and built an online survey using SurveyMonkey with a blend of open-ended and closed questions. Drawing from the framework, our survey looked at implementation complexities across 7 domains. 1. Complexity at the level of the illness or condition. 2. Technology-related complexities. 3. Complexity in the value proposition. 4. The adopter system. 5. Complexities at the level of the organisations. 6. Complexities at the level of the wider system. And finally, our survey examined embedding the project over time, which looked at how domains interacted. In the second phase of our project, we built an online survey using JISC and distributed it as part of a follow-up evaluation. Participants also opted into a semi-structured interview. This focused on participants' experience of our project approach, their appraisal of the framework, and their views on the potential value of this approach in guiding and monitoring implementations. Results showed that using the adapted survey tool helped participants to apply complexity principles to their implementation projects. For example, at the domain level, radar diagrams illustrate the level of agreement across responses to survey questions asked in this domain. Comments captured reflect some of the open-ended responses. Complexity mapping showed that CF remote patient monitoring implementation had a high level of complexity across several domains. The highest level of complexity was found in Domain 6, complexities at the level of the external environment. Key findings showed implementation complexities in areas such as accurate and reliable data capture, changed ways of working in the clinical workflow that required new or radically revised core processes and pathways, challenges in implementing at scale, a lack of SLAC resources, low organisational digital maturity, with funding and resourcing uncertainties noted as project barriers. Challenges with lack of structure to enable knowledge sharing were highlighted, as were the absence of electronic health records and clinical coding in realising the full value of project benefits. Results of the thematic analysis of interviews showed that participants' quotes could be categorised under 3 overarching themes. Under Theme 1, Influence of the Wider Context, participants highlighted the influence and impact of organisational, national policy and broader system aspects. Under Theme 2, Awareness Raising, participants highlighted how the process of engaging with our project survey tool helped provoke their thinking on the multiple components of a project and help deepen their awareness of interrelated complexities. Suggestions for improvements on the approach include tailoring the survey tool to the stage of project implementation and building in a facilitated process to help clarify domain concepts. Under Theme 3, Guiding and Monitoring, participants described the potential value in using the adapted tool to surface wider considerations for scale-up and sustainability. Our project showed a practical way to creatively adapt the NASSS-CAT tool in the evaluation of remote patient monitoring implementations. This provides a blueprint for others. There is potential for the approach to be used as part of evaluating project readiness as a decision-making tool to help surface complexities early in a project planning phase. Local teams could also apply this approach across the full life cycle of their implementation project. Frequently in projects, there is a little time to step back and appraise the full complexity of interrelated components parts of the health innovation or the context for the implementation. Applying the framework offers teams an opportunity to frame their thinking and strategically plan. The approach may also help guide decision-making about how telehealth solutions are introduced, scaled up and sustained. Thank you for listening.